Baclofen is a medication that is used to relieve muscle spasms. It can relieve the spasticity associated with flexor spasms. It can also reduce the pain that is associated with the spastic conditions. It can reduce the muscle rigidity and involuntary movements. It is available as tablets under the brand names Lioresal and Gablofen. It is also available as an oral solution under the brand name Dosage. Involuntary movements and muscle rigidity can be observed due to any damage to the spinal cord. Therefore, Baclofen can be used to treat spasticity associated with spinal cord injuries or spinal cord diseases. Baclofen is also used to treat spasticity that is associated with multiple sclerosis. In this condition, you may feel muscle stiffness, tenderness, and heaviness. You can also perceive pain during movements. It can also induce involuntary muscle contractions of arms and legs. Baclofen can relieve these muscle spasms. It can also be used to control the involuntary movements due to any damage to a few of the neurons. This video covers a few important facts about this medication, like how it works, when to take this medication, what its effect is on drowsiness, and what precautions and side effects are to be noted. First, let us see how this medication works. Baclofen works by modifying the neuronal activity in your brain. It is not directly acting on your skeletal muscles. Instead, it is acting centrally to control neuronal activity. Its main site of action is on the spinal cord. The communication at the spinal cord may involve more numbers of neurons. Baclofen can act on monosynaptic junctions that are formed by two neurons. It can also affect the polysynaptic reflexes. An excitatory chemical mediator called glutamate can stimulate neurons that induce contractions in the skeletal muscles. When glutamate is released, it can produce excitation in the neurons, which send the signals to the skeletal muscle to produce contraction. In the people with spasticity, this neuronal conduction is overstimulated, resulting in the muscle spasm, pain, and involuntary movements. However, the activity of glutamate can be controlled by another mediator called GABA. Baclofen increases the activity of this mediator. It acts as an agonist on the GABA-B receptors. On the presynaptic neurons, this can prevent the opening of calcium channels and inhibit the release of neurotransmitters like glutamate. On the postsynaptic neurons, it opens the potassium channels, leading to hyperpolarization. This prevents their excitation and neuronal induction. Baclofen can activate both presynaptic and postsynaptic GABA-B receptors, thereby controlling the neuronal activity. This prevents muscle spasms and rigidity. How to take this medication? You can get the Baclofen as tablets as well as granules. It's also available as an oral suspension and an oral solution. Tablets are available at different strengths, starting from 5 milligrams to 20 milligrams. You can get the oral solution at low strength, such as 5 milligrams, and a double strength, such as 10 milligrams. The oral solution is well known by the brand name Dosage. Baclofen is also available as an intrathecal solution for injection purposes. For the treatment of spasticity resulting from multiple sclerosis, Baclofen can be given as 5 milligrams orally 3 times daily. After 3 days, the dose can be gradually increased by 5 milligrams up to 20 milligrams, given thrice daily. So the initial total dose is 15 milligrams per day, and the dose can be increased to 60 milligrams per day, gradually based on the tolerability and clinical response. However, the maximum dose should not exceed 80 milligrams per day. This medication can be taken either with or without food. You can take this Baclofen with food if you have any stomach upset. If you are using oral granules, you can mix them with either 15 milliliters of liquid or soft food. However, remember that it should be taken within 2 hours after mixing. When you're taking it with food, try to avoid a high-fat meal. A high amount of fatty content in a meal can reduce the absorption of Baclofen. This may produce a delay in its action. What are the precautions to be noted? In the people who have had a stroke, use of Baclofen is not suggested. This medication may not be properly tolerated in people with stroke. Therefore, it may be avoided. It is also not indicated for treating the spasm associated with a rheumatic disease or in people with Parkinson's disease. If you have any renal impairment, you should use Baclofen carefully. This medication is mainly eliminated through the kidneys as unchanged. Therefore, if you have any impairment of your kidneys, the levels of this medication may be increased in your body. That can lead to its toxic effects. Baclofen can produce acute urinary retention. If you have any urinary obstruction, it may complicate the condition. Baclofen may increase the induction of epilepsy or seizures. If you have any previous history of seizures, you should use this medication carefully. If you observe any loss of seizure control, it should immediately be reported to your doctor. Baclofen may also produce loss of balance. Particularly, it may be noticed if it is used for the conditions where the spasticity is required to maintain the upright posture. This medication can increase any psychotic disorders. So if you have any previous history of hallucinations or psychotic disorders, it may exacerbate the conditions. It may increase the hallucinations and confusion. Therefore, close monitoring is required in people with a previous history of any psychotic disorders or confusional states. Baclofen can reduce your gastric motility. This is important if you have any peptic ulcer disease or gastrointestinal obstructive disorders. This may induce severe constipation or even gastric reflux. When it is given to the pregnant woman, this medication can produce a few defects in the neonates. Particularly, it can produce withdrawal symptoms in the neonates, leading to increased muscle tone, tremors, and even seizures. This medication should be used in the pregnant woman when the strong benefits are anticipated. However, it should be gradually discontinued before the delivery. Sudden discontinuation of this use of this medication may result in a few withdrawal symptoms. It may increase hallucinations, fever, and altered mental state. You may have rebound spasticity and muscle rigidity. It can also increase the risk of seizures. Try to avoid sudden discontinuation of this medication, and if it is required to withdraw this medication, you should gradually reduce the dose over a few days. Baclofen can induce drowsiness and sedation. It may decrease your alertness. Therefore, try to avoid operating automobiles or dangerous machinery until you feel comfortable. This drowsiness can be further increased by intake of alcohol or by use of any other CNS depressants. Now let's see the side effects of this medication. With the use of Baclofen, you may have the central effects. One of the important side effects of this medication is drowsiness. This is common in many people who are taking Baclofen. It can also produce lightheadedness, weakness, and confusion. Few people may experience somnolence, a state of sleepiness with altered alertness. You may also notice a decreased muscle tone and weakness. You may have reduced blood pressure. Decreased libido and difficulty with ejaculation are also observed. You may have a headache, insomnia, and increased urinary frequency. That's all, guys. These are the few important things about Baclofen that should be known while using it. Thanks for watching this video. Please share your experience and how it works for you in the comment section below. Have a great day.